Good afternoon, viewers. I am Dr. C Nair, a physician, cardiologist and diabetologist practicing in this vicinity. And I have been given a topic about heart, how healthy your heart can be and how it should be managed in our day-to-day lives. It assumes so much of importance because heart itself is such a lively organ in our body and such a dynamic organ. It beats continuously at the rate of 70 to 80 beats per minute all throughout our life. And therefore, it assumes great importance in our life because of the significance of providing food to all the vital organs and all the tissues inside the body. So the heart is powered by the blood circulation it has by way of coronary arteries. These arteries are supposed to provide blood to the coronary, through the coronaries, to the heart muscles to help it to pump as significantly as possible. And therefore, if there is any compromise in this coronary artery circulation, the heart muscle suffers and therefore it is not able to do its job as it should. And therefore we see that ways and means should be there to try and keep these blood vessels healthy. And one of the important reasons why these blood vessels get affected in the heart is because of sometimes congenital problems or sometimes hereditary problems that we have. It can be due to some habits like smoking or tobacco chewing. It can be our lifestyles because of the unhealthy lifestyles that we have, no rest, we go on and on with lack of exercise, no concentration on your body weight, all these factors, and also ignorance about your certain diseases which are commonly seen by way of blood pressure and also diabetes, along with high cholesterol or what is called as lipids. And if we concentrate on trying to control these factors, we find that our heart will be more or less healthy if we can maintain certain good lifestyles. And by blood pressure, I mean we should try to achieve a target of about 130/80 as per international guidelines. It is important that you should not keep in mind the age factor. Age is not the question here. It is a question of keeping the blood pressure at 130/80 in all age groups. Similarly, we have targets for sugars also. Your blood sugar fasting should be around 110 and post-lunch should be around 140 to 150. With the average blood sugar of 3 months, which is called as HbA1c, should be around between 6.8 to 7. And if you can maintain this, of course, then you would call your diabetes as well controlled. Similarly, lipids, what we look at most importantly in lipids is what is called as LDL cholesterol, that is low density lipoprotein cholesterol, which is the main culprit in causing atheromas, atherogenesis and blockages inside the blood vessels. And therefore, it's important that we achieve this target by way of diet control, by way of exercise regularly, at least 150 minutes in a week to be precise, or approximately around 40 to 45 minutes of walking and other exercises in a day. And if we can achieve this, we can even add on sometimes statins. What we call as statins are medicines which keep all these blood lipids in control, including your LDL cholesterol, so that we can achieve a target of around 100 in non-cardiac patients and about 70 in cardiac patients. It is not very important that the triglycerides to be limited, but at the same time, we should keep an eye on abnormal levels of triglycerides. And similarly, I think the other parts of the lipids also. So I think this is the way we should look at in trying to protect our heart from all extraneous factors which can contribute to diseases of the heart. I have a question by Sanket Agarwal. Can exercise and diet help me no longer need my cholesterol and blood pressure medicines? No, Sanket, that all depends on your levels of blood pressure, also on your levels of cholesterol. You can try and see if you can achieve the targets. Maybe with exercise and diet, we can try to avoid medicines. But that should not be our aim. Our aim should not be to withdraw the medicines, our aim should be to achieve the targets which we have guidelined. There is a question from Tahir Ansari. Are cardiopulmonary problems hereditary? Yes, to some extent they are hereditary, and we can't do anything much about that except take care of the risk factors, as I mentioned just now. If you can protect yourself against the abnormal risk factors, yes, then at least you can alleviate yourself from these problems. There is another question coming in from Yasmin Khan. Is fasting good for heart? I think fasting is not good for anybody. In fact, you keep your stomach empty for a long time. It doesn't help us much because your insulin levels go up, your acidity output increases, and therefore it doesn't help in controlling, except that you start eating small frequent meals or maybe some meals in between, which will help you to control yourself. So I think it's important that during these fasting that we undertake, you should see that your blood sugars, particularly in diabetic patients, it should not go into a lower side. And if it goes into too much of a lower side, what we call as hypoglycemia, I think things can be bad also. And these patients can get even brain damage because brain is very sensitive to glucose. And it's important for its metabolism. Glucose should be provided at adequate levels. And therefore, at least around 100-110 milligrams per deciliter of sugar should be there to maintain a brain function, proper brain function. Now, there are quite a few medicines which we talk of, indigenous medicines to keep your hearts and blood vessels healthy. One of them is methi seeds, which we have highlighted many people, and the other is flax seeds, which also helps. Nowadays, we have some inputs coming in about the role of turmeric in keeping our health, heart and blood vessels healthy. And therefore, this is also a good sign. If you can use these adjuvants like antioxidants, which are there in our common multivitamin pills. These antioxidants are lycopene and vitamin E, vitamin C, some trace elements like magnesium, manganese. All these things help us to prevent oxidation, what is called as oxidation of the LDL molecules, thereby preventing lesser damage to the inner lining of the blood vessels. If you can prevent the development of atheromas, I think you would have achieved a great deal in keeping our circulation intact. And that is one of the factors which is very important. There's another question coming from Dhirendra Singh. What are the complications of systolic murmur? Is it curable? Dhirendra, it depends on what is the murmur due to. If suppose you have an elderly patient who has got a lot of atherosclerosis and calcification, you may call what are called benign murmurs you may get. And these murmurs are not of great significance. But if the murmurs are due to some congenital heart defects, or if the murmurs are due to some valvular defects like aortic stenosis or mitral stenosis, where the valves become little constricted, then these murmurs are significant and they have to be attended to properly by your own treating physician. Another question which is coming in is from Manisha Saddev. Is chest pain normal after heart attack? Now, it all depends. It doesn't mean that after heart attack you cannot get a chest pain. It depends upon your vascular circulation situation. If you have attended to a heart attack and if you have tackled the immediate part of it, I think there are other blood vessels also which are following in with maybe different degrees of heart blocks, which can also give rise to chest pain. It also depends on your level of stress that you take, both physical and mental, and this can contribute to some amount of pain. There are also some reports which talk about virgin coconut oils, which help us to maintain our blood vessels and heart healthy. And I think that is one of the important factors we have to keep in mind. Along with these are plenty available in our country, especially where we have a lot of cases where these oils or these sort of things have contributed to the health, general health of human beings. Okay. So I think our targets in our day-to-day lives should be trying to achieve a systolic pressure of around 130 with a diastolic blood pressure of around 80. If you can achieve your blood sugar levels around 110 fasting and for 140 post-lunch, And if your lipids, LDL particularly, is in the range of 70 to 100, I think you would have given enough protection by way of your contribution to maintenance of circulation. And as far as the diet is concerned, I want to highlight that it's important that you should have a proper high roughage diet. You should eat less of low roughage like non-vegetarian food, red meat, and other things which doesn't help you much in our day-to-day health. It's important that you have more green leafy vegetables, more dals, and less cereals if you possibly can, and try to stick to this regimen if you can have maintain a proper health. And it's important that your liquid intake also should be adequate, unless you have been asked not to have too much of liquids because of certain cardiac conditions or other conditions where fluid overload is not so good. There are many drugs which are available nowadays in the control of diabetes particularly. It's important that your doctor would probably choose which sort of anti-diabetic drugs are important in your particular situation. If there are many drugs which help you to even reduce body weight nowadays, we have got newer and newer drugs which help us to control blood sugar along with body weights. If suppose by some chance you have got some affliction in the kidneys, then obviously certain drugs cannot be used or it has to be used with care, and sometimes some dosage adjustments may be required. Similarly, in high blood pressure cases also, we have different drugs for different situations. Suppose a person has a high fast pulse rate, then certain drugs like beta blockers would be indicated. Suppose the patient is a kidney patient, again there are certain drugs like ACE inhibitors or ARBs which are good along with calcium channel blockers. This has to be decided by your doctor, treating doctor, as to which condition would be suitable for certain types of drugs. And it's important that there is a myth in ourselves that taking these drugs for too long, or maybe if you can try and withdraw these drugs, I think that sort of a notion should not be there with us, because it's important that your target remain healthy. And in spite of taking medicines for a long time, which is absolutely more or less any side effects. So it's important that we concentrate on taking the drugs which is prescribed on time and for the necessary length of time as per your physician's advice. And that helps us to control these parameters. Let us not worry too much about the side effects. That can be taken care of if at all it comes up. And it's important that the dosage also schedule should be preferably along with the timings be maintained. It's very important that we should try to adjust our medicines according to the situation. There are some people who have got thyroid complaints which add to our body weight, which also adds to our problems like hypertension and other problems, especially if you are a heart patient. Maybe the chances of dyslipidemias are more in people with low thyroid states. So this also needs to be highlighted and has to be taken care of at appropriate level with appropriate medicines. I think it's important for our laymen to understand that you should have regular checkups upon these factors. Regular checkups at least once in a year, it helps us to maintain the check on the parameters that we have. There are not necessarily need to be any symptoms or any changes in our life pattern. Sometimes if you have a routine checkup, you pick up many things in the routine checkups, which can be attributed to certain diseases in future, and also which helps us to control and nip it in the bud. And therefore, in that routine health checkups, we have even seen sometimes some infections being caught on, sometimes even early malignancies are detected. And all these factors are important and which is included in the routine health checkup. We have seen many cases of high blood pressure, which is supposed to be a silent killer in most parts of the world. being detected in a routine health checkup because we may not have any symptoms. It's important that you have a regular blood pressure check to help us to control the BP at the earliest possible stage so that you don't have any side effects, you don't have any target organ damage as time goes on. All these factors are very important. There is a question coming in from Virendra Singh. What exercise will you recommend for a healthy heart? I think any sort of exercise, depending upon your cardiac condition. If you are a non-cardiac person, I think any exercise in limited quantity should be fine. One of the best exercises one can indulge in is walks. Of course, you can go for a gym where you can have treadmills in limited way, and also you can have cross trainers, mild weights can be lifted, and swimming. Swimming is one of the good alternatives that we have as a form of exercise. Now, in a person of diabetes, we have seen that people who sometimes are prone to get chest pains, sometimes ischemic heart problems without significant chest pains, and all these cases we should be on the lookout for silent ischemias. And because diabetes is one of the diseases which affects both the smaller blood vessels and the larger blood vessels, and over a period of time you find that they lead to some complications like ischemic heart diseases, sometimes cardiomyopathies, sometimes even on the long run it can lead to high blood pressures, and it significantly affects the kidneys also. So a kidney damage probably has to be picked up at an early stage by way of checking the levels of proteins being secreted in the urine. And it's called microalbuminuria or proteinurias, which may be significant, may not be significant in some people. But these are the early warning signs of kidney damage in a diabetic. Similarly, it's important that you should keep a close watch on the cardiac function in a diabetic, because regular checkups by way of stress tests is important to pick up early signs, subject to your this test test being approved by the treating physician in a particular individual. Timely checking up of BP is also important. Now, the most important thing in a diabetic is regular checkups of eyes, because you have eye is a mirror of what is happening inside the body. And if you have particularly the fundus examination, that is the inner and inside part of the eye is checked, you can always pick up many things which are signs of both microangiopathy and macroangiopathy. If you pick up these signs, you should look for this in bigger organs also, and maybe that may be a forerunner of things to come as time goes on. It has to be focused on in many of the people, and they have to be told that you should go for regular checkups once in at least 6 months of the eyes if you are a diabetic or a blood pressure patient. By way of exercise, I must say that it's important that people who have had an heart attack, or maybe if you already had suffered from some ischemic heart diseases, you should be consulting your doctors as to the level of exercise that one can indulge in. Some people it may be contraindicated to do gymming or treadmill exercises because of the background of the diseases that they have. In those cases, particularly in certain old age groups, I think walks would be the ideal thing, and walking at a moderate speed would be good enough for keeping the patients healthy. And that's very important from the overall point of view. But some sort of exercise, I think, always helps us to maintain our blood circulation and also to keep our lipid levels in check, our cholesterol, our blood sugars on the check. It even helps by dilating the blood vessels to some extent of keeping your BP also under control. and therefore nothing can be more emphasized than the of exercise. It is important that one should definitely go in for regular type of exercises, and it helps us growing in many cases. There is a question coming in from Babanand Yadav. How does high blood pressure contribute to heart diseases? Now, that's a good question, Babanand. The high blood pressure is the blood pressure by itself means the pressure at which the blood is flowing through your blood vessels. And now, if you have a higher blood pressure, the blood is flowing at higher pressure through the blood vessels, thereby the chances of the internal lining of the blood vessels being affected, like for example, the endothelium being affected. And similarly, high blood pressure also is putting extra load on the heart, and therefore the heart has to pump against more load, more pressure, and that creates certain changes in the heart muscles, which are called as left ventricular hypertrophies. Now, the blood vessels damages leads to gradual production of atheromas over the areas where there has been endothelial damage, and therefore slowly you start getting diseases of the blood vessels in various organs because of high blood pressure. It is also important to know that your kidney glomerulus filtrus is also affected by high blood pressure, and therefore you start noticing that slowly you start getting damages in the glomerulus, and therefore you can start getting what are called as early onset nephropathies. There is a question from Prachi Sadwekar. Does cholesterol accumulate right from an early age, or do I have to worry about it only after I am 30 years of age? No, it is possible nowadays. We notice, Prachi, that you start getting cholesterol even at a younger age group. It depends on familial dyslipidemias, as we call it, right running in families. Children who are not very much bothered about or cared for the diet point of view, these people can have early onset of cholesterol increase and therefore deposition and other side effects. So it is not necessary, though we often commonly see people having dyslipidemias after the age of 30, but it's important that we take care of even children as far as the diet and exercise are concerned. Because these are the days when we sit in the house and watch mobiles and TVs, and with very much less exercises as compared to what we used to do in previous times, we find that there are more and more cases of obesity in children and also dyslipidemias and diabetes also in children. So people can get young age diabetes. Of course, there are people are born with diabetes, which are called as juvenile diabetics. So it's important that we keep a watch on all these factors right from a very young age group. There is a question from Dhirendra. Is CPR effective for acute MI? Yes, certainly. I think if you find that certainly on the wayside, as you're traveling or if you're somewhere in the station, you find somebody collapsing, if you can give a very important cardiac massage in the third and the center of the chest behind the sternum, you find that these people sometimes they revive the heart beatings which have stopped temporarily, and also if you can give mouth-to-mouth breathing, respiration, they also get impetus in coming out of the episode. So it's important that you should give CPR even in a patient who is found to be collapsed on wayside, which is possible for you to give even in an area where there is not much of facilities. There is another question which is coming in from Samir Sawant. Does taking birth control pills raise the risk of developing heart disease? Yes, it is, because many of these hormones we have to monitor. It can increase certain problems in the heart muscles or heart blood vessels, and you can have a risk of putting on weight also in because of certain things. So it has to be probably balanced out with your gynecologist and keep a watch on your body weight and other problems like high blood pressure. Uh, Another question which is coming in is from Preeti Mahadik. Do men and women experience the same symptoms associated with heart disease? I think the symptoms of heart disease are equal in both men and women. And in those good olden days, we used to believe that women are protected in their menstruating age groups with certain hormones. Now we believe that this incidence in both men and women are equal, and heart diseases are dependent on the risk factors as we have discussed before. And it's important that all these risk factors be controlled. The symptoms associated would be almost the same in both these sets. There has been some questions always asked about the need for taking multiplicity of drugs in controlling diabetes and also blood pressure. Now, it all depends on individual cases. The doctors would find, sometimes you find that your blood pressure needs control with probably multiplicity of drugs because a single drug may cause more side effects, or larger doses of a single drug may not be appropriate for a particular individual. And therefore, many dosages of different types of drugs are used to control the blood pressure. Similarly, in diabetes also, one particular drug may not, because you have actions of these drugs at various levels in the system. And therefore, while certain drugs act on the liver, certain drugs can act on the pancreas, certain drugs can act on the intestines, that is your gut. There are newer drugs which have come which act at the kidney level. And they have all got utilities as far as the efficacy is concerned and also the side effect profiles are concerned. There are many newer drugs which have come into the field with much lesser side effects as compared to what it used to be in for good olden days. Now, many drugs have become obsolete now, and we are opting for these good drugs which have got good metabolic effects and lesser side effects as time goes on. This question from Deepali Sound. Does being overweight increase the risk of heart disease? Certainly, I think there's no question about that, because the overweight contributes many other concomitant diseases like high blood pressure, diabetes, and dyslipidemias also. And obviously, your heart is also under load to circulate, give circulation to larger areas of the body. Therefore, basically, it would mean increased pressure of the heart. And along with the other concomitant risk factors, you can always expect problems in obesities. And therefore, our aim should be to try and reduce the weight as much as possible. An ideal weight would be your height in centimeters minus 102, which would be the ideal weight. If suppose we can maintain that, I think nothing like it, with maybe 10% here and there, plus or minus. Now, to achieve an ideal body weight, it's important that first of all, you must control your diet. And there, of course, the sugars, the oily things, the high fat content of food should be avoided, including cereals if possible, as much as we can, and indulge more in certain types of fruits and vegetables which help us without trying to keep long hours of fasting, because that may not be really helpful in reducing weight in many cases. It's important that you should eat timely, but lesser quantity of food. And particularly in the nights, if you can try and reduce your food when the metabolism in the body is low, I think that helps us to recover faster and have some weight loss in these patients. Virendra Singh wants to know why CVD is more prevalent in men than women, as there are more male patients for angioplasty and CABG than women. Well, that's an interesting question. In fact, we used to always believe that men outnumber women in these cases, but now we find statistics show that both women and men more or less are equal in these diseases. It is not exactly necessary that males are more often subjected to angioplasty and CABG. The incidence is rising even in women. Because I feel the lifestyles, the stress levels, and the other concomitant diseases which we have discussed is equal in both men and women. Nowadays, we find women also are under a lot of stress. and also the effect of the habits that they have formed also contributes to more and more incidences of heart diseases and other problems. There has been some cases where people have felt that before menopause, their women have some protection from all these vascular diseases. It is really not quite true, because we find that there are many factors which is irrespective of the hormone status of the person, you can still get these subject to these stress levels. Now it depends on whether you have early onset blood pressure or maybe early onset diabetes, which remains for a long number of years afterwards. By which way you find that even in the middle-aged group, people start getting complications of these diseases. And therefore, it's not necessary that women should be protected as one used to think before. The incidence is almost equal now, if not more, in women. It's important that one should also get a fair amount of sleep in the night. It's important to give the body enough rest so that the metabolism also is maintained. And it's very, very important that many of these people who have insomnia, who don't sleep well in the nights, there people can get problems of rise in blood pressure or other cardiac involvements. It's also found that most of these people are under tremendous stress early morning when their hormone levels are in a crucial time. So it's important that one should always try to have adequate sleep. One of the best methods to get proper sleep would be have some exercise in the evenings, and also to have some warm milk in the night with some badam pieces, and try not to indulge in sleeping pills as far as possible. But if it is necessary to take it to achieve some good sleep, I think it's worthwhile, because lack of sleep is much worse than indulging in these tablets sometimes, and it will to help us to maintain our body structure and control. Another aspect of trying to maintain yourself stress-free is by also trying to read some spiritual books or listening to music, which also helps to sort of lighten the sympathetic tones in many of these people who are subject to great levels of stress because of various reasons. I think also for little diversion to all these pastimes, or to also have some interest in these spiritual matters, would be of great help, as we have found in day-to-day practice. And that probably we would advise people, in terms of those who are willing to do that. It helps to a great extent in controlling the blood pressure and also indirectly controlling the blood sugars. There was an earlier question about the valvular murmurs, which we have not discussed in detail. If in our country we find that most of us are subject to rheumatic heart diseases, and which affects the valves inside the heart, particularly the mitral valve, and therefore the incidence of these valvular diseases are much higher in people who have rheumatic fevers. And it's important that this strikes at a younger age group, and when people get these problems in the younger age group, we have much better ways of tackling this valvular stenosis or incompetence, and it's important without even probably a major surgery nowadays. And if we can try and control these diseases at that stage, maybe the damage to the heart muscles or the stress into the heart muscles which are increasing because of this stenotic valves or because of the incompetence of the valves can be to a large extent prevented and ameliorated through these procedures. So it's important that these diseases are picked up in young age, particularly if a person at a young age group, at the adolescent age, develop fevers with joint pains, and one should look for rheumatic factors, rheumatic fevers. And there are certain tests which confirm this, and also by way of echocardiography later on, you can pick up if there is any damage to the heart vessels and heart valves rather. And if you find this coming up, it's important that you should attend to it by way of medication and also by way of interventions to sort of lighten the valves. Now, what tips will you recommend to save golden hours after acute MI, and what are the symptoms? The myocardial infarction, when it comes up in the acute phase, many people get constriction of the chest. You get palpitations, you get sweating, increased sweating episode, and along with that, you get breathlessness in the tent. So when you get these sort of symptoms, which are unusual, one should certainly suspect that it could be a cardiac event. And one of the important things which you can do in these cases is to get hold of some statins if you have at home, or if you can get it from a neighbor. And if you can get some blood thinners like aspirin or clopidogrel, you can give a loading dose to these patients before you take them to the hospital. And maybe a tablet of nitrate also would help in those situations. So it's important that we can keep this handy, or maybe if you have at home, or if your neighbor is there having this tablets with them, you can make use of this during golden hours and try to reach the person as early as possible, because the time factor is important in preventing the extent of the damage to the heart muscles. And there are what are called as primary angioplasties nowadays, which is done as soon as possible within the first 3 to 4 hours. If it can be done, the cardiac muscle damage is very much likely and very much helped in these patients. In our towns and cities, we may still have some facilities for reaching hospital nearby within the prescribed time frame. But we find that in certain areas like villages and other places, it may be difficult to reach hospitals with facilities for angiographies and angioplasties. In those cases, we can only give them injections to dissolve the clots and try to give them support, try to give them blood thinners, and try to protect the heart damage as much as possible till we try and reach them somewhere to certain centers which have facilities for angiography and angioplasty. And these days, we have various types of stents which are available, especially the drug-eluting stents, which are very protective and which last longer. And the chances of reblocks are much less compared to the bare metal stents which we used to use before. And therefore, a person who can be subjected to primary angioplasty at the golden hour, I think benefits a lot from if you save the myocardium. I think it's one of the biggest achievements one can have as far as the life and the general life for that person. A question from Manira Rangara: can all types of heart disease be treated by surgery or intervention? Now, it depends on the type of heart disease that you have. There are many cases where they are not fit enough to undergo surgery. There are many cases where they may not be, sort of in need for intervention. It all depends on the disease that you have and the degree of the disease. If suppose if I have a heart coronary arteries which has got multiple blockages, which is more than 70% to 80% in content, I think these patients can be helped definitely with interventions. But if you find that the blockages are not very significant and it is less than 70%, we can still try and give them a chance with medications and lifestyle modifications and thorough checkups in between at regular intervals, and trying to assess that the disease is not progressing. But whereas at the same time, if you have many blood vessels involved with larger diseases, probably surgery would be the only answer in those cases, where you putting in 3-4 stents may not be very feasible. And in those cases, I think a surgery would be a great help. And the results of the surgeries are increasingly becoming good these days with the help apart from the interventions that we do in cardiac cases, it's important to understand that even after the intervention, you have to try and protect the heart and also to protect the blood vessels and the stents from re-blockages with the help of regular intake of good blood thinners and also statins, which help us to preserve the plaque stability. It's important. And most of the problems that are seen are when you have a plaque rupture. And when there is a plaque rupture, you find that there can be acute event and this can be pretty bad. And therefore, these statins, what we take in adequate amounts, I think prevents these plaque ruptures, stabilizes them to a large extent. We have many vulnerable plaques, which we call as soft plaques, which doesn't have much of calcification. Only thrombus is there or the platelets are aggregated. These are the people who are very prone to plaque ruptures and very bad cardiac events. And it's important that if you take long-term statins, these plaques will get stabilized gradually, and I think that helps us in the long run from preventing an acute event. And as far as the side effects of these statins are concerned, which is often a question which is asked, the side effects can be muscular pains because it increases the muscle enzymes and also produces musculopathies. But these incidences are much lesser, and the significance of the statins in our day-to-day life should be highlighted and should be understood, because it's important that if the side effects can be tolerated, it helps a lot in trying to continue the statins when we take this. So statins have come a long way in trying to help us in preserving the vascular structures. It also helps us apart from controlling the lipids. And one should not hesitate from taking adequate amounts of statins, thinking about the side effects. And of course, if the side effects are there, your physician would be the right person on the job to try and manage that. There have been many cases where we have stopped the statins for some time, and then after maybe a month or so, gradually put in a small dose of statins, when at that time you may not experience these many side effects because of the statins. And it helps us then to continue the statins, which is quite protective in many cases. One more factor which we have to keep in mind, there are certain drugs which are not indicated or contraindicated in certain situations like bronchial asthma. See, if you have a blood pressure and bronchial asthma, one should be careful when you use certain drugs called beta blockers. And if you have got a kidney disease, again one should be careful in using certain drugs. And therefore, it's important that proper adequate treatment is channelized according to the underlying disease of the person, so that they remain without any other complications of these medicines. Any person after management of a cardiac event or maybe intervention or surgery, it's important that they should be careful when they start the exercises again. It should be done in a gradual phased manner, and also look for any symptoms coming up after the starting of the exercise, especially when you are walking or maybe exercising in the gym. Even if it's a mild exercise, if you start becoming symptomatic, I think it's important that you should report to the treating physician or the cardiologist and try to alleviate or judge what exactly is happening. Because there are cases not unknown to have restenosis or re-blocks, sometimes even a bypass surgery. After the bypass surgery, the grafts can get re-blocked. And though these incidences are quite less as we see these days, but one has to keep in mind, it's not that you are immune from developing any further symptoms or any diseases once the procedure is over. So the care should be taken, and the possibilities should be kept in mind. And one can otherwise, if you tolerate this, gradually build up your exercise levels, and that will better your lifestyle as time progresses on. So I think probably we have gone into some basics of managing cardiac problems. We have understood how important the heart is as an organ, and I hope this message will be taken home with a good sense, and be in touch with your physicians if there's any issue with regard to this, and hope that you all have a very good life here on. Thank you so much.